Good morning, everyone. I'm glad to see so many people have come here to learn about and carry concern about the kind of preventable events in hospitals that make for premature mortality and terrible suffering and the requirement for additional treatment, which drives up the cost of hospitalizations. You've probably heard by now of the kinds of findings that DPH studies have come up with in the previous year about the number of infections and serious reportable events in hospitals. Actually, the AARP bulletin yesterday compiled some results of studies that said that nationally the number of preventable deaths that occur in hospitals are equal in numbers to 4 full jumbo jets crashing every week. And that really puts it in perspective. I think as AARP points out, if we had that kind of mortality from aircraft flights, there would be a national outcry. And there is, thanks to Healthcare for All and the patient safety community, an increasing outcry about serious events and all kinds of mishaps, infections occurring in hospitals. And I think this will help it's starting already to show some improvements in some areas. And if anything can end this preventable scourge, it will be this kind of advocacy. I will just mention briefly a couple of my bills that were reported favorably out of committee. One is a bill designed to cut down on MRSA, to do screenings for high-risk patients in hospitals. It's in healthcare finance. It's House 614. I'm going to be circulating a letter looking for support to get that bill reported favorably out of healthcare finance, along with House 613, which is a bill that would promote the use of checklists, which are those simple kinds of planning tools that make sure that practitioners in surgery and intensive care and other specialized areas of healthcare make sure that they've got the right patient, the right body part, the right diagnosis, the right amount of a prescription medication, and generally help to keep people alive and getting appropriate care through a thoughtful, logical approach to how care is given. I think everyone is probably at the end of a long event and looking forward to conversation and refreshments. And I want to thank Amy and everyone else from Healthcare for All and all of you who are here. Thanks so much, and speak to me if you want to sign on to bills.